Parents around the country are sending their children back to school this month. But along with all the excitement of a new school year, there are also potential hidden dangers regarding parental rights over their children's health. It begins with parental consent forms that schools send out each year, but it's also related to a much larger federal agenda to make schools the centerpiece of a national socialized healthcare system. Dr. Jameson Taylor, AFA's Director of Policy and Legislative Affairs, is with us today. Hello, Dr. Taylor. Welcome.
Hi, Jeff. Thanks for having me on today.
You've written an excellent article in this month's The Stand magazine where you go into a lot of detail on the potential dangers of some of those consent forms. Why don't you start there and then paint the broad picture of what's going on here?
You know, I've been hearing stories about parents being blocked from their kids' medical records for a couple of years now. And even here in Mississippi, where I live, a good friend of mine, her husband is a neurosurgeon. She went to our state-funded hospital, supposed to be the best hospital in the state, and she was blocked from her 12-year-old's medical records. So we started to do some research, and suddenly the hospital backtracked. They said, well, you know, we didn't mean to do that. Well, actually, you know, we're going to give you 2 more years. Her child was 12. And they said, we'll give you access to that child's medical records until the child turns 14. And that really set me down a trail to figure out what is going on here. Why are we seeing parents are being blocked from their kids' medical records, and the hospitals can't point to a law that is requiring it. It's just that they're doing it. And as I did more research, I saw, for instance, that the federal government is pushing this, especially through the Department of Defense. So if you're a parent who's covered, for instance, by DoD medical insurance, you have probably already experienced this. And parents in states all across the country are experiencing this, that they're going to the hospital and suddenly they're finding out that they cannot get access to their kids' medical records. Unfortunately, that is just the tip of the iceberg. What we're finding is that the Biden administration, the Biden-Harris administration, is setting up Obamacare 2.0 in public schools. They are bypassing state governments and they're funneling government Medicaid funds directly to the schools. And as part of that, they're working very hard to eliminate parental consent for healthcare, and they're blocking parents from kids' medical records. So, you know, here's the thing. Parents really don't want to believe any of this. They don't want to believe it because then it makes life difficult. It forces parents to confront school administrators and doctors. It forces parents to fight for their kids. But this is what we have to realize. This culture and the Marxist Democrat machine that is in power right now, they are coming after your kids. Here's one example. Just yesterday, the state of Massachusetts passed very radical legislation eliminating the natural concept of the family. A family in Massachusetts now, under Massachusetts law, is what the government says it is. You say your kids are yours. You gave birth to them. No, the government now will decide. Not nature, not biology, not blood ties. These are constructs, according to the left. They don't matter. In Massachusetts now, the government will decide who a family is, meaning who is the mom, who is the dad, and who is the child. So, you know, this is all happening right now.
Certainly is Orwellian in its scope. Let's take it back to the parents and what they're going to encounter potentially this month as they send their kids back to school. One of the ways this may manifest itself is in a school consent form. Could you talk a little bit about that and what parental rights are on those forms and what the school may do with that?
So as you're sending your kids back to school, you're going to receive these forms from the school, and they're going to ask for your signature for this and for that. One of those forms is probably going to say, do you consent for us to provide emergency health care to your child? Now, that's something you should consent to. You know, if your child is in an accident at school and they need to go take the ambulance to the hospital, it's important that they get the care that they need. But you have to be careful if that consent goes beyond that. For instance, if the school says, do you consent for us to provide medical care and mental health care to your child, for instance, an aspirin, whatever it may be, that's where your alarm signals should start to go off. Because when they say aspirin, Band-Aid, comma, etc., The problem is what is in that et cetera.
Okay.
And it could be what we're finding out, reports in schools around the country. It could be sex change procedures that guidance counselors and others are steering kids toward that. It could be contraception and abortion. Right now, there's a lawsuit over whether or not the government can provide contraception to children without parental consent. That's a case called the Deanda case. But it could also be vaccination. We saw just today a Vermont Supreme Court said that a school was not liable when they quote unquote accidentally vaccinated a child against COVID. The parents found out about this. They had asked that their child not be vaccinated. They had no knowledge of this, obviously. The child was vaccinated. They sued, and the court said, well, we're dealing with school administrators here, and I'm going to let them off the hook. But this is what is starting to happen in schools. You're seeing literally comprehensive healthcare services are being provided in schools. And this is all under federal law, under something called the Bipartisan Safer Communities Act.
Right.
Comprehensive physical healthcare services and mental healthcare services being provided in schools. And as part of that, there's a push to eliminate parental consent over that healthcare.
I want to circle back just a little bit and talk about some of the medical record access. You've written in the article in this month's The Stand magazine regarding the Health Insurance Portability and Accountability Act does not require or allow a parent access to medical records if the state in question either has laws to prohibit access or is silent on the issue. Are you saying that the default position of federal law is to say, parents, you have no access unless the state grants that right in some sort of positive way?
That's right. Your state has to specifically say that parents have access to their kids' medical records in order for you to be given that authority to view their medical records under HIPAA.
Okay.
Now, there's HIPAA, federal law, which governs access to medical records, and you have a mishmash of state laws that govern access to medical records. As we have dug into this issue, what we're finding is that the laws are very confused. So you may be in a state where you think, well, hey, I know we have a parental bill of rights. I'm sure I'm covered. No, not necessarily. You may be in a state where you even have a specific law that says that parents can get access to their kids' medical records. Well, maybe, but you may have had a court in your state that may have qualified that in some way. And again, what we are talking about are comprehensive healthcare services offered in schools. So you might be asking, well, how is this happening? What's happening through Medicaid, which is a government insurance program supposed to be for low-income families, but the Biden administration has, quote unquote, streamlined enrollment. So you have Medicaid, which will be funding these services. You might think as a parent, well, don't I have to pay for this? I would have to exercise consent through that. No, because Medicaid is going to pay for it. What they're also doing is they're streamlining. This is the word they love. They love to talk about streamlining. What that really means is removing any barrier to what we want to do with your kids. Mm-hmm. So they're also streamlining parental consent. Now, unfortunately, they started with kids with special needs, which is kind of shocking. They said, we think we need to streamline Medicaid billing for children with special needs that are getting services in public schools. Well, what they found out was that these parents are very engaged. They're very informed about the health care that their kids are getting. And so what was happening is that schools would start to provide one service in school, let's say speech therapy, and that's covered by Medicaid. And then the parent wouldn't know about it, and they would take their child to get speech therapy at another provider outside of school, and Medicaid would say, well, we already paid for that. Okay. And so it was creating problems, and there's been a lot of resistance in the special needs community to push back on this. So far, the federal plans to completely eliminate parental consent, they've been a little bit put on hold. But if Harris is elected president, this is definitely going to be pushed very aggressively, and schools are pushing this very aggressively. And there's a reason why. It's called money.
Yeah.
Medicaid is now one of the major revenue sources of public schools. This is the thing that parents need to understand. You might love your principal, you might love your teacher, but we are talking about billions of dollars Medicaid funding that is now going to public schools. So those schools want access to that money. They're not necessarily going to allow things like parental consent to get in the way of them billing for these services. So there's all the incentives are working in the wrong direction. The incentives are for the schools to provide comprehensive health care to kids without parental consent.
Well, it's clear where the federal government is going. Jameson, what are state lawmakers doing to head this off? What's going on around the nation and in our state laws to prevent some of this?
Yeah, this is something that people are just waking up to. And I think it's important to kind of realize the gravity of the situation that we are facing. And so as parents and lawmakers are thinking about how to respond to this, the main thing I want to leave with you is this. This is an emergency.
Okay.
This is very, very important. And so if you are not proactive, they're going to get their hooks into your kids. If you're not aware, they're going to get through. And so that's the first thing for parents. You have to be aware. And as far as that goes, I think there's some concrete things you can do. First, if you can, run for your local school board. You have to run for your school board. The Biden administration is bypassing states, and they're directing this money directly to school districts. So you have to get on your school board, and you need to raise awareness about the need to protect parental consent for medical care, and also for things like health class and sex ed and all that type of stuff. What you need to seek is an automatic opt-out, meaning that every child is opted out of a medical procedure or a sex ed class or whatever it may be. They're automatically opted out unless parents provide very specific consent. So that's the first thing. The second thing that you can do is go to your school, ask them for you to look at the medical health care consent forms. And if they don't have one, then call your school board and ask them, do you have policies related to medical consent forms and healthcare consent in our school? And if they don't, I would encourage you to draft up your own. Go on the internet. I'm sure there are some good examples. Draft up your own form, get it notarized. A lot of banks will notarize things for free, and give that to your school. Now, really, I don't know what your school is going to do with that. I think they're probably going to freak out and call their school board attorney, but that's going to start an interesting conversation about what are your school's policies related to parental consent and healthcare. And then the other thing you can do is talk to your state lawmakers. Talk to them about protecting parental consent. Here in Mississippi this last year, we passed a law to make sure that parents can get access to their children's medical records. Now, that said, we have a lot of work to do because we have other laws that conflict with that. And the hospitals are fighting our attempts to reform those laws. The hospitals are on board with this. And that's one of the problems that we have seen. Even if you pass a law in your state, it's possible that your hospitals will ignore that law. They're going to throw some mumbo jumbo at you like HIPAA, FERPA, whatever. And, either they're lying or they don't actually know the policy. I think it's a mix of the two often. But you have to be aggressive in defending your children's healthcare because, again, we are dealing with rats.
Yeah.
And just like the devil, they are seeking to devour your children.
Well said, Jameson. Thank you for that analysis and for those action steps that we can take. I want to mention to our listeners that the article Parents' Consent Not Required by our guest, Dr. Jameson Taylor, is in this month's The Stand magazine. We'll put that on our podcast page along with the checklist of what parents can do. We'll also highlight some sources that you can go to see this information for yourself. Jameson, thank you for your insight, for your hard work on this, and we want to follow this as it continues to develop, and we appreciate your insight today.
Thank you, Jeff. Thank you for your work.